Nick Athanasiou.
Elaine Baird.
David Abel.
Alice Thomason.
Tony Pearl.
Okay, and is there anyone here for public comment?
Do we have anybody online?
Anybody online?
No hands raised.
Okay. Thank you, in which case then, Chief Deering, it's your turn up to talk to us about two things. I see you have the fire rescue material up here. Let's start with that and then move on to the other one, talking about the overtime.
Sorry, I just need just a second. All right. You grab just in case you need it. Mike, Peggy will be happier if you do that. Good evening, everybody. Jeff Deering, Fire Chief, Deputy Chief Tim Gula is with me. We were asked to come in tonight to talk about two particular things. One, fire department overtime, the second, a new fire rescue facility. We thought we would take this opportunity to, in order to sort of shed light on the overtime process, that we'd give you a little bit of a department overview to sort of set the stage and build the foundation of how we operate and where those needs come from. So I did put together a brief PowerPoint to sort of work through that. And I just want to take a quick moment to recognize the people that work at the Orleans Fire Department. In particular, over the last couple of weeks with the blizzard, our staff has worked incredibly hard.
They were wonderful.
And we're incredibly proud of the work that they do for our community. Our mission statement is up on the PowerPoint. We're in the process of revisiting our strategic plan. Our first one we did in 2020. It's good for about 5 years, and we're in the revision process right now of building that. It's been a great tool for us moving forward with a lot of participation from our staff. And they've revised our mission statement, our vision, and our values recently as part of that. And we're in the process of getting ready to publish that and put it together. But it's a dedicated professional organization committed to serving this community, protecting life, property, and the environment through a bunch of different things: fire suppression, prevention, pre-planning, emergency medical services, rescue operations, disaster preparedness, and community outreach. We do a lot of different things within the fire department. We're sort of the catch-all in a way, and that's the way many fire rescue departments operate in the United States, is when there's no one else to call, you call the fire department. Our members developed this vision statement, and I'm incredibly proud of that, because we want to continue as a highly trusted and respected fire rescue organization, recognized for operational excellence, empowered leadership, continuous learning, unwavering commitment to service, and we're going to do that through professionalism, innovation, compassion, effective communication, teamwork, a culture of wellness, integrity, and shared values. And I think these things are important as we get into our conversation tonight. These are the things that guide our organization and guide us as the heads of that organization. I'm not going to go through all the core values, but I feel very strongly that our staff developed these through integrity, professionalism, teamwork, and we sort of alluded to those. It explains that, and we're really proud of that. So to get into the department, a little bit of how it operates currently. As of right now, we have 33 full-time members, and what that is made up of is the chief, deputy chief, our executive assistant, Melissa, our EMS coordinator, fire inspector, and then 4 shifts of 7 members. So there's 28 people essentially assigned to fire suppression and emergency medical services at the shift level, at the delivery level in Orleans. Those members work a 24-hour shift. So they come in at 8 o'clock in the morning, they work till 8 o'clock the next morning, they take 24 hours off, they come in for the next 24 hours, do it again, and then on paper they have 5 days off. That is a common schedule across the nation, particularly in the Northeast. It is collectively bargained. We've had it since 2000, 2001. We've operated on that schedule. I can tell you that during those 24 hours, they work pretty hard. Each day, we start the shift with 6 members on duty. So again, stepping back just a tiny bit, there's 7 members assigned to each group. We start with a daily minimum of 6. So one of those people could be off on vacation, training. We have a number of members who are out on injury or medical leave currently. So we actually have 4 of those total. So each shift is already down 1 person currently. Another thing that's important to recognize is that our staff does what we call both jobs. And that's a common misnomer sometimes in our community, is that the fire and medical delivery are separate organizations or separate staff. It's the same 33 people that deliver that service for our community. And sometimes it's as simple as a fire call comes in, our members get on a fire truck, and a medical call comes in, and they get in an ambulance. They cross staff. So another way to look at it is when the ambulance transports to the hospital, we don't have staffing for the ladder truck. When the second ambulance goes to the hospital, we don't have staffing for the fire engine unless we recall people. So they're doing both jobs on a daily basis. Talk about call volume briefly. 2025, we did 2,866 calls for service. We have seen a steady upward trend in calls, really through my entire 25-year career in Orleans, but in the last few years, you can see those numbers. 2020, we did 2,643. Last year, we did 2,866. There's a little fluctuation there every year, but there is a consistent upward trend there. So far, we've done 770, well, actually, it's more like 782 right now. When I built that slide this morning, they hadn't done the calls that they've done today. As part of that, within that 2,866 calls last year, 1,250 of those were transports to Cape Cod Hospital. That was a number, that number is up about 75 transports from the previous year. And again, you can see sort of a steady increase in those transports over the last 5 or so years. A typical ambulance call from the time they leave Orleans, time they get the call to the time they're back in Orleans is between 2 and 2.5 hours, depending on the type of call, traffic, those kind of things. But understand, we're 30 minutes from the hospital in each direction, so an hour of that time is really just on the road time, with the hospital being in Hyannis. Another important piece of the puzzle for us is multiple calls. So the unfortunate part about our job is we can't plan when we're going to have emergencies. And the challenge that we have seen continuing to increase in the department over the years is when we have more than one call simultaneously. And we've seen those numbers continue to increase. So on the screen, you'll see that each month we have sort of a percentage of how many calls that we have going on at any one time. One call, 2 calls at the same time, 3 or more calls going on at the same time. And we see, when I started in Orleans, that multiple call number was between 15 and 18%. The average is in the high 30s to close to 40 on a year-round basis. So we're a lot busier than we were. And it's not just the total number of calls, it's how the calls come in or that they're at the same time. The type of work that we do, again, we're an all hazards organization, so if there's something on fire, we're going to respond to it. Whether that's a structure, vehicle, brush, we deal with alarm calls, gas emergencies, hazardous materials. We spent a lot of time with wires down recently, but those are the types of fire calls we respond to. Emergency medical services, that really runs the gamut. Our staff provides high-level, advanced paramedic care in our ambulances. They are highly trained. They're supervised with very specific protocols that are generated between the state of Massachusetts and our local medical director. They really, the level of care that they can provide at a patient's side in their living room and in the ambulance is quite exceptional. And they carry nearly 50 different medications, as an example. When I started as a paramedic 30 years ago, we had about 25. So the level of care that they can provide, the things that they can address, the things that they can take care of in that ambulance while going down the highway is really, really, really special. Also, our members are trained, we have a number of members that are trained in technical rescue as part of a county-wide team. Those members are involved in wide area searches, water rescues. We had members involved in the trench rescue that occurred in Yarmouth in the late fall. We had members involved in the dog rescue the other day in Falmouth. They travel all over Cape Cod. It's a regional team, so they go where there is a need. One of those pictures in the middle is at our sewer treatment plant. There was training there, so they are trained to deal with emergencies there. And being surrounded by water, we have a definite need to have boats and be prepared for emergencies that occur on our waterways. When we're not responding to emergencies, we're involved in fire prevention and inspection. We're involved in educating our community. There's lots of different activities that our staff does. Most recently, we've had a number of our staff working with middle school health programs to train them in CPR and stop the bleed, as an example. You'll see our staff out at the community events, whether it's the 4th of July parade or the bonfire, the concert at Nauset Beach. A successful fire rescue organization really is reflective of the community that it serves, and we are proud to be part of it. From here, I just want to provide some information that sort of sets things that we, as the management of the Orleans Fire Rescue Department, look at in deciding on how we address staffing, how we look at risk, those kind of things for our community. We aspire, and that's something that I'm very proud of, that Deputy Gould and I have worked hard in our tenure to use data to drive our decisions. Whether it's local data through what we collect as our records management system, as the calls we go on, but also national trends and research. So one of the things that we're using right now is what is called the Firefighter Rescue Survey, which in the last couple of years has tracked 5,000. And let me back up. This stuff wasn't traditionally tracked real well at a national level, but has now come into the forefront of fire departments. They're actually tracking it when people are rescued from burning buildings nationally. There's a database for that. And we get questions about, well, we're busier in the summer than you are in the winter. And to a certain extent, that is true. June, July, and August, like everybody else here, is busy for us. There's more people around, there's more calls. At the same time, the risk continues year-round for us. And in this particular graphic shows the time of year when rescues occur. And the highest rescues nationally occur what would traditionally be, by Orleans standards, the quieter months. However, the risk is still there. So we have to manage that risk of when do we staff in case one of these things occurs, because we can't predict it. We have a sense of it using the data that fires occur typically more in the winter, and the rescue survey shows that. Another piece of that is, Chief, why don't you staff more during the day than you do at night? When we look at the rescue data, most of the rescues occur in the overnight hours. So that's why we use a 24-hour shift schedule model with that staffing model.
Is it okay?
Yeah, sure, I'm sorry. I'm going through a lot, so.
Yeah, just a quick question before you leave that previous slide, because that seems counterintuitive.
This one?
In terms of numbers of rescues and when those occur, because am I thinking about this correctly?
This is based on national data.
Okay.
And that-
Do we have data that kind of accounts for our distribution over the 12?
Our call volume, yes, we can look at that. What we're looking at in this graphic is when those rescues occur. When most fires occur is during the winter months. And so from our standpoint is that the risk is still high year-round. So changing the staffing model significantly in the off-season creates a higher risk to our community.
I mean, I think it would be hard to change the staffing pattern just because it is, it's never a set pattern of behavior for your work. But I just was curious as to what our data looked like, since our population is 3 times the size or more in the summer.
We can, if I go
4
back real
times.
quick, I'm going to just scroll back real quick, sorry. But you can look in this chart, under the total calls, so the second from the right,
Yep.
those are total calls by month in 2025. So you can see, as an example, in April, there was about 175 calls, as an example.
Yep.
And August was 343. So there is a seasonal,
Yeah,
and to me, as you would expect.
right.
You can't,
But that's good data.
yeah.
For
So,
a
but
variety of
the
purposes.
risk is still there,
Yeah, sure.
regardless of time of year. So,
So another way to say that then is the volume is bigger in the summer, it's actually lower in the winter, but you have, like insurance, you have a higher risk.
yes.
So you have to be there, so your volume's not as high, so yeah, it makes sense.
Yep.
Yeah, thanks.
I'm just going to go back to where I was, sorry. Another important national sort of statistic, and we hear, is fires are down, and there is a decrease in the number of fires nationally, but what we have seen nationally is an increase in fire deaths. And again, that goes back to that risk management model that we're seeing fires that burn hotter and faster and are more deadly and toxic. Again, that's a risk management tool that we look at from a staffing standpoint. We also looked at the National Institute for Testing and Standards, NIST. They did a study that was done to show efficiency of crews during firefighting operations. So the number of people on a particular piece of fire apparatus performing standard fireground operations, like moving an attack line or a fire hose, conducting a search. The more people you have on one of those dedicated to that, the better it goes, is basically what it comes down to. They are more efficient, things get done more effectively. And that was done, again, using data. That was a national study that was done and shows why having staffing is important. That's for fire trucks. On ambulances, we get a question, why do you run 3 people on the ambulance? Where I came from, there were 2 people on the ambulance. We get that a lot. On Cape Cod, it is standard practice that most organizations run with 3 people on their ambulances and send no other resources to those calls. So in many cities, they send a 2-person ambulance accompanied with a 4-person engine company. There's 6 people there. We send 3 and 1 resource. We're also 35 minutes from the hospital, and the type of care that goes on in our ambulance is pretty complex. And yes, you can do that with 1 person, but it is not as a vision. It's not good patient care. We have seen this as a tool to manage the risk of injury of our staff, is that 3 people moving a patient is much safer than 2 people moving a patient. If we were to change that, I think we'd have a major challenge of recruitment and retention. We've studied this a number of different times. It has been looked at. We had a staffing study done years ago. We've looked at it as part of our strategic planning process. We feel very strongly that this is the best deployment of our people on a daily basis for the types of calls they respond to. And it is the practice across Cape Cod. So we're not the outlier there.
Chief, excuse me, would you say then that the ambulance is an extension of the emergency room?
Yes, absolutely. Some of the equipment that we have in there, the emergency room doesn't have.
Okay.
Like, we have incredibly trained, number one is our staff, the level of training that they have, but then the equipment that they are provided with. They have, most recently, we bought new cardiac monitors. They're incredibly capable devices of helping to interpret when people are having a heart attack. And unfortunately, people have heart attacks. We can treat that in the field and recognize that.
So one thing that, this is an N of 1, fortunately, but in the one time when you responded to us at home, what I noticed was that by the time we got to the emergency room, they were lined up and knew exactly what they had to do, where to put the patient, who was ready with whatever, whatever magic, at that point,
It's a pretty impressive operation from the time you pick the phone and dial 911 and you speak to our dispatchers and they coach people through how to treat a medical emergency, while simultaneously a second dispatcher is putting that call out. So there's overlap there. There's not a delay to our staff responding and treating and communicating that to Cape Cod Hospital. And so that at the time that the patient arrives with our crew, the hospital is prepared for that, whether that patient's going to go to a trauma room or go to the cardiac cath lab or go right to CAT scan because there's a question of a stroke. It's pretty seamless, and a lot of it comes down to time, and time is really important in these emergencies.
Thank you.
We provide a fair amount of mutual aid, and what's important about mutual aid is that it is mutual. So last year, we responded out of town 134 times, and we had our neighboring communities come in about 120 times. And that is pretty close, and that's what you want it to be. The idea is for it to be mutual. In years past, that balance was not balanced, and we had to address that. But in most recent years, it's sort of evened out. And Cape Cod is a unique creature because of its geography and the staffing models throughout Cape Cod. So there is significant reliance on mutual aid throughout Cape Cod. Our ladder truck, as an example, basically responds to fires from Harwich to Provincetown very early in those incidents because of our staff and because of the type of vehicle it is, but I can assure you that the communities around us are also providing some sort of resource with that as well.
Do you also train with the other towns?
Yeah, there's a lot of cross-pollination that way, that our staff, through either the medical training often is, but we will meet with our neighbors, and in the classes we run regionally, we do as a group, so you'll have 100 firefighters in a room, and they're from 20 different departments. So there is a lot of overlap that way, which breeds a lot of cooperation and collaboration. And even though the fire trucks may be different colors, I can tell you that they work well together and very seamlessly. We're all in the same communications center or system, so that helps with that as well.
Thank you.
There's a lot of stuff that goes on that way. Another thing that we look at is the National Fire Protection Association publishes standards or recommendations as far as different practices within the fire service. One of them is structure fire staffing requirements, NFPA 1710. They all have a number. Based on consensus, these are large groups that develop these standards with lots of different stakeholders, develop best practices. The sort of crux of this slide is that the recommendation at a structure fire, so single-family home, is 17 firefighters to start with. We have 6 on duty. We have to rely on our neighbors to provide that. So at the report of a structure fire in Orleans, as an example, I will show it here. These are run cards. So everything is predetermined. So under the line, sort of on the left side, you'll see line response. So Eastham, Harwich, and Brewster are dispatched simultaneously with us. So 3 more towns come in on the report of a fire. Once it's determined that there's a fire, then we Chatham, which WF stands for working fire. That's the confirmation that a fire is occurring. Chatham sends an engine, Yarmouth sends an ambulance. You can see that it takes all these communities to manage these incidents. These types of what we call run cards, what you see up here, exist for every single town on Cape Cod. And each town is broken up into districts or sections, so there's one for the main part of Orleans and another one for South Orleans. And although they're very similar, it's so who can get there the quickest is really what those are based out of. But it's all predetermined. They're not, when a call type comes in, we already have a playbook for what we're gonna do.
And Jeff, is that structure created by the dispatcher that you're part of, or a different
This
organ?
structure that you see with this particular, what we call run card,
Yeah.
is managed through the Barnstable County Fire Chiefs, or Cape and Islands Fire Chiefs Association. So there's a group that develops these
Got
run
it.
cards for each community. The community provides input, and then there's a committee within that makes sure that they all work, because when you look into the layers of this, there's apparatus coming from all over Cape Cod. We want to make sure that we provide coverage, one, to the community that has the emergency, but also sort of behind the scenes or
That's
that ripple effect.
really impressive.
It works incredibly well.
And then the dispatchers access the run cards to decide
This
wherever.
pops up when a call comes in on 911, it pops up 19 School Road, Orleans. It says Orleans District 1, and you'll see at the top of that, Mutual Aid District 1. That's their reference.
Got it.
They got the card. It goes further. This is just one example, but we have structure for different types of, so if we need ambulances, the same thing exists. We need forestry trucks, the same kind of list exists. So this is just one example sort of showing the biggest type of scenario we deal with routinely, which is a structure fire. Just want to talk a little bit about some of the staffing challenges and how we've addressed those over the years. I think we've gone through some pretty significant challenges really over the history of the department, but in the last few years with increasing call volume, the multiple and simultaneous calls that I spoke of earlier, the complexity of those calls, seeing that our staff was not coming back, their availability for callback was dwindling. We've been challenged by housing, just like everyone else. Housing is very expensive, so our members were hard-pressed to live close by and come in for those emergencies. And then ensuring the adequate number of people were available to respond to the most common emergencies that we have on a regular basis. With that, that was sort of the impetus, and through a number of discussion and of research and a lot of work, we brought forward in 2023 the staffing proposal to hire 8 additional firefighters. And that was to bring the level of staffing up from typically 4 or 5 on duty to 6 on duty. The idea was to have enough people on duty to respond to the majority of calls that we have, often the simultaneous. So we need 2 resources right away because there's a medical call on Main Street and there's a fire alarm in South Orleans. And we weren't able to do that previously. And if we did, that second resource was going with 1 or 2 people, which we know is not as safe as it could be, and then waiting for mutual aid to come. So the goal of that was to bring that staffing level up from 4 or 5 to 6, with the idea that we put 7 on a shift, so we accounted to a certain extent that someone's going to be off on vacation, someone's going to be off on training. Those things, that's just part of it. Some days we have 7 on duty, and we're in a much better position to respond to emergencies. That addition of 8 was to ensure that consistent level of service, because we had incidents when none of our department responded to. And this was in 2020, late 2022, early 2023, where we had a fire at the former Christmas tree shop. And if you look at the front of that building, there are no Orleans people there. Wow. Because 3 minutes before this call came in, the 4 members that were on duty at the time responded to a high-priority medical emergency. There was someone not breathing. They had to go to that, and then this call came in. We didn't have anybody available to respond to it. And that was happening. This was sort of a very front and center case of that, but that was happening on a very regular basis. So to get in sort of like why we're here, what drives overtime for us? Part of that is call volume. We're busier, there's more calls, that kind of thing. We have a number of training requirements, and I'll go through those in just a second. We have paid time off. Our staff work full-time. They have vacation. They have personal time. We know that. We've had contractual obligations as far as pay rates, and those things have all changed, and those drive those costs.
But how does that last item drive your overtime?
Microphone.
I'm so sorry. How does that last item drive your overtime? Because
and-
that's the question.
It makes it, their hourly rates, their overtime rates go up,
Oh, I
costs
see.
more money.
I see.
So from a required training standpoint, when we bring on somebody new, they have to go to the state academy. That's 10 weeks. There's a period of time where our staff, as they come on, do not count towards staffing because they're not fully trained yet. Part of that is they have to go to the state academy. Then there's a bunch of in-house training that they do before they're let loose that way. From the emergency medical services side, these are requirements depending on EMTs or paramedics. We have both in our department. Every 2 years, they have to accomplish these things. So just as an example, our paramedics, 60 hours of continuing education training, that includes your typical CPR, but also advanced cardiac life support, pediatric advanced life support. They have to take a refresher course and then prove competency in reading EKGs. And then they also have to go through 12 medical director rounds. So our medical director on a regular basis holds classes that reviews cases Cape-wide that our members have to attend in order to maintain their certification. Those are requirements for that practice. You'll see that it varies a little bit with EMT to paramedic, but just as an example, those are knowns for us. We also know that we have paid time off, and our people work incredibly hard, so every once in a while, a day off is pretty nice. Of our 30 members, those that are covered under the collective bargaining agreement, our obligation every year is about, when you total all their different vacation times off, depending on their years of service to the department, there's about 5,200 hours of vacation time that we know people have 900 hours of personal time, 4,600 hours of holiday time. We know that people are going to take days off because it's part of their compensation. Here's where things are hard to predict in our business, is that we know that people are going to take time off. We know we have to send them to training, and then we get a blizzard, and we need people to work. So during that 5-day stretch in February, when we had the blizzard and recovering from the blizzard, our members responded to 192 calls. Now, if you go back a few slides, there were months last year when we did not respond to that many calls in the entire 30-day period. So in a 5-day period, they did a month's or more worth of calls. With that, we needed to bring staffing in and pay them overtime. So during that time, we had 401 hours of overtime, which cost about $36,000, which is more than double what our typical week is. So,
First off, Chief, Deputy Chief, thank you for your service. You've really put together an excellent staff. When we talk about time off and overtime, and firefighters work 24-hour shifts, can time off be in increments less than 24 hours, and can overtime be in increments less?
so there, I didn't put all that detail in, but yes, that's a fair question. And yes, so typically the 24-hour period is broken up into 2 shifts. So there's an 8 a.m. to 6 p.m. shift and a 6 p.m. to 8 a.m. shift. Typically, our staff comes in and works at 24. That's their assigned shift. But they can take a vacation day, 10 hours, or a vacation night, 14 hours, or they can take the whole 24 hours off. They can also use personal time in 1 or 2 hour increments. So there is some moving parts there.
Sure.
And I'm trying to keep it simple,
Yeah.
but there is ways to do that. There's also rules based on the collective bargaining agreement that were negotiated that drive how many people can be off on vacation, how many people can be off on this type of time. So the idea is to sort of balance time off with staffing levels to keep them consistent, to sort of manage the overtime in a way, so it's more predictable that way.
So
OT works the same way, where you get called in, it might be a
Yeah,
2-hour.
so when someone's, they know they're going, school vacation is coming up in April, as an example. So we have many, many families in our organization. They're going to go away for spring vacation, or April vacation. So they'll submit time off. I'm going to take my Tuesday 24 off on vacation. So that will go into, we have a scheduling system, and our shift officers look at that and go, okay, on that Tuesday, hey, we're below, there's 2 people off on vacation that day. We need to cover that. So then it goes into a system that is fair and equitable to the members, to who gets that shift. And they will make that notification that you're up for overtime, this person's up for overtime, that kind of thing.
That degree of flexibility that you have, is that, I'm always worried about retention and how hard it is to find someone, how long it takes to train them and continually develop them, and how easy it is for someone to pick the fire or EMTers off. Does that kind of flexibility enhance the retention and the attractiveness of your department over the other towns? Or are the other towns run in a similar fashion?
I will say that in the last few years, there has been a significant improvement in the collective bargaining agreement with I think townwide, but I can speak for the firefighters, that has enhanced a number of those things with the idea of attracting, recruiting, and retaining staff. And to a degree, it has been successful. We have brought in most recently 3 firefighters new to our organization, but coming from other organizations, one with up nearly 20 years of full-time experience. So they bring incredible knowledge and experience to our organization. We've hired a lot of people. Since 2020, when I became chief, we've hired 16 people out of 33. So we've become very young very fast. And that doesn't diminish the talent of those people. We've brought in incredible people, but they're new. And so being able to bring in people that have experience has been very helpful to our organization. And that flexibility is part of that. I mean, there's lots of things that go into recruitment and retention. That's one piece of it, and that has helped a lot. And I want the best people I can to work for the Orleans Fire Department as chief. And I think we all have a vested interest in that. And that is something that is really, I think, has changed in our community for the better. And it's made my job, in a way, much easier because we're bringing in super talented people that do a good job, and a lot of them are already trained. So that ramp-up time is much less. You know, sending someone to the academy, sending someone through initial training is months and months and months. We bring in somebody from another organization that has already been to the academy, that's an experienced paramedic. That ramp-up time is now weeks, maybe months.
Do you have a dollar number for the initial training of a new person?
I'd have to look at that, but I mean, it's just the academy alone is over $10,000. And then that time that they're not available to do that. Now add in paramedic training into that. You know, we've been very successful, particularly recently. Deputy Gula, once again, our grant guy wrote a federal grant that was for paramedic training. So we can send 4 of our newer people who were EMTs to paramedic school. It was $231,000 grant to cover that. So that's a significant investment. Or we didn't send those people. And so that's huge. I'm sorry.
Tony?
Chief, are there different collective bargaining agreements among the various towns on the Cape, or are you all pretty much the same?
Each town that has a fire department has an individual collective bargaining agreement.
Are they similar, or?
There is often similarities, and there is always looking at what Community A is doing versus Community B versus Community C. It's very, very competitive. And that's, you know, who's being compensated at what other things, what the insurance premiums are, those are all factors in that.
Well, I think you're to be complimented on how many people you've brought in.
We've been very lucky, and that is, I think, credit
Not just luck.
to the town, to Kim and the town staff and the select board for supporting that, and really the community for supporting those changes and those improvements. They were significant, but they were very good improvements to the organization.
News.
I have a question from, I seem to recall a while ago when we were talking about all this, that you were talking about getting accreditation for your department. Where does that stand?
We're still working on it. It's a multi-year.
A year, and we haven't met all the standards that we could submit between like 6 and 8 years of data you have to have. So we're still working on that portion.
And if you had to, sorry, you're saying you're working on the next 5-year plan now. Presumably, you're looking at what we have accomplished out of the first 5-year plan.
Yeah,
How do you feel?
we took a deep dive into in the first plan, what I would call the first plan. It was really one of the first strategic plans the Orleans Fire Department ever did. What we accomplished, what changed during those 5 years.
Yes.
Because things change, what became priorities and where the efforts were, and then what we do going forward. There was a lot of that. We had a lot of input from our staff on that. Like, hey, these things worked pretty good, and we had things that, we've got opportunities to do better on. And we're learning from those, you know, but there was a lot of effort, you know, particularly into addressing staffing in the big chunk of that, and that took up a lot of that. So,
Thank you.
Jeff?
John?
sorry.
John, speak.
John, so
So this is very logical and very helpful. On strategic planning, let me ask the logical thinking I've got. This is directing in the direction that as more people are trained, and as you're able to retain for the environment they're working in people, if you did strategic planning, the logic that I would expect people would say when they talk about overtime is, well, fully staffed, fully trained, appropriately scheduled overtime over a period of time going forward is likely to go down. Now, do you see, is that logical?
Potentially, we're so far behind as an organization, particularly when it comes to managing call volume and then having people out. Like, we have 4 people out of work right now that aren't part of that mix. So we start out the day behind already of this. We're already, if one more person takes a day off, we have to fill that overtime. Also our organization did not do a good job of investing in professional development for close to 20 years. And we've hired 16 people who need training and development. So those are where some of those areas, do I see it leveling off? I hope so. But to significantly reduce it, we're not there. If I go to next year's, we went from this year 987 to $1 million, just over $1 million next year. That is in line with our neighboring departments. And I'm to your point. I want to use what I have here because I think it shows it. What is happening with our overtime is that we're actually starting to go backwards in the number of hours that we have available for overtime. So even though it has, next year is a 3% increase from this year, 3%, 29,000, it's a 3%. We're actually losing percentage of hours available to cover shifts, send people to training, and respond to emergencies. So even though we're stabilizing, we're not doing big increases in it, with their hourly rate going up based on collective bargaining, the average overtime rate goes up 7.2% next year. The budget went up 3%. When you divide the budget by the average overtime rate, and that's the average overtime. It rotates, so someone who's paid at a higher rate may take a shift. So it messes with that a little bit. We're actually going backwards in the total number of hours that we're going to be able to cover.
Jeff, I think you just started to make a comment about how this type of overtime compares with other Cape Cod towns. This is like standard amongst.
It is, yeah. So when you look at, we were able to get data from 2 of our neighbors, Chatham and Harwich. Chatham, slightly more, I think 1 more person per shift. They're at 8 people per shift. Harwich runs at minimum of 7, and they'll go up to 10, I believe. But you'll see that we're the lowest of the 3.
So do you use AI to run all this?
Do I use? No. I use a $7 calculator on my desk. Yeah, tiny calculator on my desk, quite honestly.
I mean,
To ask Siri to do it for you, Jeff.
I'm an analog guy. But we've been working, this is a challenge for us. This has been a challenge for us for as long as I've been in the department. It's been a challenge. It's always been a challenge. And I look at and now sitting in these roles, we look at it every day. How can we solve this? But at the same time, ensure that we're going to provide a consistent level of service to the community. And if we were a manufacturing organization, I don't know a lot about manufacturing, but I think it'd be easier to manage that way, at least from where I sit now. There's a lot of variables, and as soon as we get a blizzard or something happens, it really can, as much as we try to manage that, we're looking at, when are the busier months? When are the not so busy months? How are we, going forward, particularly next year, do we look at, and I haven't gone this far, but like in our summer months, when are our busier days? Do we put people on those days? When are the less busy days based on previous data? Again, we can't fully predict that. Like today, we had 3 ambulances on the road, at least once, and 2 of the ambulances were on the road most of the day. It's March. Like, what's July and August going to look like for us? I don't know. That's the challenge.
Alice?
Yeah, Jeff, before we leave this topic of the overtime, I wanted to say, the preamble to this discussion was great to hear from you, but I just want you to be assured that nobody questions the integrity and the hard work of your department. So, we're so appreciative. I think the conundrum is that 3 years ago, when we were told that 8 new firefighters were needed to help level off some of these, the needs, the demands, and the costs, it hasn't quite panned out in the way that the expectation was in regards to this overtime. So hopefully you can understand that. And I guess what I would ask you is, you know, the blizzard was horrendous. It's an anomaly. So when you're thinking strategically going forward, thinking of all the elements that you've laid out for us today that are the moving parts and whatnot, you know, is there an expectation that this can be managed to reduce that overtime? And if not, I guess the next question I would have is it more cost-effective to hire another person or two? Because, you know, that's a huge sum of money annually. We could hire 5 people, you know, or 4 maybe, or 3, I don't know. So how does that play into your strategic thinking going forward, given the situation?
The 7 people on duty that we went to is the most we can fit in the current facility.
And there
We
is,
understand
is
that.
the-
And that
It's
is
a good
why
transition point.
That's exactly right.
we went with that, like, we looked at that number very hard. We went through a significant exercise, and
So cut to the chase, Jeff. The reason that we're paying so much in overtime has to do with the size of the fire station?
I think, I'm not sure
No,
that
but I mean,
that is,
but
but like,
there's a relationship there.
there is a relationship, like, there is probably a breakover point when hiring more staff is more cost-effective than paying overtime. But I'm not sure where that number is, but I know that we can't fit any more people in our current facility. And down the road, the community is gonna have to look at what is the appropriate level of protection that they want to pay, and for the level of service. We are looking at a new facility that would ideally meet the needs of the organization and the town for 50 years. That's always the goal when you build a new building. And it's really hard to predict. But we foresee through our research, through our strategic planning, through our thinking, that there's gonna be a need to staff another ambulance or another resource. And then the question is gonna become, if all 3 of those ambulances are out on a call, who's protecting Orleans? Do we have another set of people that are always dedicated to fire suppression? Those are the kind of things that we're gonna have to figure out going forward. And the new facilities, part of that is we're looking at that, is how many people should we have on duty? And then incrementally look at that, especially as new housing comes online, as call volume changes. Those are the things we're gonna have to look at. You know, when we hired the 8, we hadn't hired anybody since 2014. There was a 9-year gap. And before that, in 2014, we hired 2. Prior to that, it was 2005, we hired 2. And the original plan in 2005 was to hire 2 in 2005 and hire 2 in 2006 to sort of spread that a little bit. Then we didn't do anything for a long time, and we got to a crisis point, and that's where 8 was important. Is that was the most we could put in the building, but also make an impact in raising that level of staffing so we could provide the level of service that was being asked of us with the current staff that we had. So it was a dilemma. I think down the road, I do see that I don't think we're done. I don't think we're there yet. I think we're surprised at how much the call volume has jumped in just a few years, particularly the multiple calls that we're seeing where the 2nd and 3rd ambulance are out a lot. Even more than they were in 2020, 2021, 22, as we were working towards the 8 hires.
Any more questions?
Well, I have a question. You know, this is sort of hypothetical and has to do with the size, too, of the building, I think. And I hope I'm not going to ask in English. And if you have more people that are training on site, all right, instead of training in Falmouth, let's say, and you have an emergency, can these people jump in an ambulance?
Depending on the emergency, yeah, and the class, yes.
Okay.
There are some classes that are mandatory, or they don't get credit for the class.
Yeah.
So like, as an example, our medical director rounds, which I spoke of earlier, they're participating in those and they go on a call, they don't get credit for it.
Okay.
Because they have to be there for the entire length of the class.
Okay.
So.
Thanks. But if they're in Falmouth, it's unlikely that they're gonna
Yeah.
go there anyhow, yeah.
It was an hour and 3 minutes to Falmouth the other day for me when I responded to that talk, so.
The dog.
Chief, I know that Tim won't brag about himself, but could you tell the committee how much in grants Tim has been able to get for the fire department over the recent past, which is money that we have not had to spend?
Yeah, most recently, Deputy Chief Gula authored a grant where it was $231,000 in federal assistance to firefighter grant. That is specifically for, to send 4 of our staff to paramedic school to cover their tuition and associated costs, but also backfill and overtime related to that, which is tremendously helpful, having more paramedics coming in because that helps staff the ambulances. There was a period of time where paramedics were incredibly hard to come by, particularly when we were looking for 8. And so to be able to train them, it takes 18 to 24 months to train a paramedic. So it's a long process. But that is an example. But over the many years, how many years have you been writing grant? 15 plus? Writing grants on behalf of the citizens of Orleans. We're probably in the $1.5 million to $2 million total-ish. I wish I had that number in front of me because it's not all those grants are $231,000.
Right.
Some of them are $16,000.
Right.
Some of them are $7,000. But the amount of work that goes into them, actually, we find that the ones that are less money are more work. And then the management of those, in particular, we'll say that is a huge part of what Deputy Gula's time is managing those grants, especially when it involves payroll issues. So with the associated costs and management of these paramedic students, there's a payroll piece of that where when we're buying new air packs, it's a little more cut and dry because we're procuring items. But without Deputy Gula's efforts, there would be significant costs passed on to the taxpayers.
John?
So while my logic didn't work too well, let me summarize what I believe I'm hearing you say about overtime, so you can correct me. This level of overtime is really baked into the budget, that you might be able to manage the rate of increase going forward by management skills. But the logic that over time, we are going to see, and I think the town's going to be doing some 5-year projection of revenue and expense, we aren't going to really see, even with fully staffed, fully trained people, we really aren't going to see or don't expect to see, not just in Orleans, but even through the industry, don't expect to see a decrease in overtime. So is my understanding better than my logic?
I think that there's not a significant decrease coming immediately, and that's what I would say to that. Our demands and the things that we're trying to catch up on are still there, and we're very careful about training as an example. What we send people to, what we don't send people to. We deny more training than we sign off on from overtime standpoint because we're looking at ensuring. When I look at my neighbors' budgets, if we look at Chatham, we see the total number, but they break theirs out into shift and emergency overtime, training, and other. So they have a dedicated training budget. We don't have a dedicated training budget. We have one overtime pool that we have to manage between covering shifts, responding to emergencies, deciding who goes to training, making sure we cover required training, those kind of things, and that is challenging that way, because I think we miss opportunities sometimes to send people to stuff that I would like to send people to, because I'm trying to invest in people. For the typical firefighter works 32 years in a department. We want to develop them, and quite honestly, neither one of us is going to be here forever. As much as I really like doing this, so we're very much looking at succession planning within our organization, or right now, it's hard to believe, but we have to, and we've got people that are several steps away from different roles in our organization that I want to invest in, and we have to, and I think there's a number of reasons to do that, but mostly it's smart for the health of the organization.
Jeff, this has been a terrific presentation. I think I've learned more today, what you've just said in the past hour, than I have in some years being on the Finance Committee. And that having been said, I had hoped we'd have time to talk some about the fire rescue station, and since an hour has gone by, I think I'd like to move along, ask the committee, do you have any specific questions about fire rescue? And then we'll save that for another time, because we have Judith and Alan also
Yeah.
waiting.
You-
So if you have a specific question, Tony?
Chief, you've convinced this skeptic and changed my mind, so thank you for that, what you've done. Who is responsible on the Firehouse Committee for publishing the minutes? The reason I ask is since I'm not a member of the committee, but I'm a liaison, I was told by the assistant manager of the town that I couldn't see the plans and that kind of thing, and I had to wait for the minutes. Minutes haven't been published since last November, so wondering who is responsible for
I
them.
would have to suggest you speak to the town manager's office. I'm not sure.
Okay.
No, I know I don't publish.
I know you don't do them, but I just didn't know whether the committee had decided who.
Maybe the chair of the committee.
Yeah, or the chair.
Anyway, any other specific
Yeah,
questions?
very short question. In the operating budget, Jeff, it appears there are 2 deputies. Are there 2 deputies?
We're working towards that, yes.
I see. Thank you.
There being no further questions, thanks, this has been just terrific.
Thank you very much.
Thank you.
Thanks, Chief.
Thanks to both of you, yeah.
As a customer of your ambulance corps, thank you very much.
So,
Thank you. No, we're not doing the station, right?
no, not doing station, unless that's what I said. If they have any specific
wanna make
questions
sure.
about it, then we've taken enough of your time, and
Thank you very much.
thank you. So Judith and Alan, welcome. I hope that was educational for you.
That was terrific. I really enjoyed it.
Good, good. So, I think as a little background,
I will reckon.
Grab one of each and pass them around.
the Finance Committee has been getting, I think anxious might be the word a little bit in here, because we've finished our first 3 phases, phase 1, 2, 3, and I think we're looking, as I was adding up today, and and I'm sure you have it at your fingertips, but we're somewhere around $140, $150 million in terms of the first 3 phases for the amount of money that we've put out. And I know we have ways in which we've been covered with some types of loan forgiveness, et cetera, in there. And in some respects, we're not, where we're coming from is that we are looking at funding the $60 million firehouse coming along and wondering, after the meeting that we had with Scott Walker, March 12th, how is the debt going to start hitting when we come to 2030, 2031? Where I think we heard between $700 and $1,000 per $1 million of property value to pay for the fire station. That's going to be on top of how we are paying for the debt and debt service coming into the 2030s. And I think you've heard some of us getting cold feet and thinking about, well, wow, we're looking at this May town meeting and the $2.7 million, down from the 5.3, to fund the phase 4. And then last night, Rich did a excellent presentation explaining why we have to keep that train moving at this point. I think especially since we have new people on the Finance Committee, and we are looking at coming into the next phase 4, I think this is a good time to kind of look back and say, here's what phase 1, phase 2, phase 3 has accomplished, where it's gotten us in terms of nitrogen reduction, and then here's how we are moving on for it. So that's kind of the conversation that I want to frame for all of us. And I kind of do want it to be like group conversation so that we all kind of understand where we're going with the wastewater.
Okay, so,
Judith,
and I
did you pass out something?
did.
information?
It should be going around.
Passing around.
Yeah.
Okay.
And having just passed it around, I just realized I gave away all my copies, so I'm,
We have one for you.
Yeah, there's extra.
Thank Thank you so much.
His back. So perhaps, these just came out of this morning's wastewater management advisory committee, and it seemed like timely to bring them. What I will do is jump to this one first. That answers and talks to and speaks to what have we accomplished so far. So a quick diversion with that, as I sit here with you all, and I very much appreciate the invitation to join you, I've got to think back a little on where we've been in Orleans through all of this. And honestly, it just kills me that back in 2008, when we had our original wastewater plan, we didn't go forward then. That plan was 6 phases, 3 years per phase. The entire thing would have been done in 18 years, which means that right now we would be celebrating the connection of the last home in Orleans to accomplish our nitrogen reduction needs. It would be over and done. That didn't happen. So it got pushed back, pushed back, pushed back. It's basically the same footprint, approximately the same number of properties, pretty much the same amount of nitrogen removal that are needed. And it varies somewhat year by year, phase by, area by area, but it is pretty similar. I will say it was advantageous that we had to wait, because thanks to Alan and a couple of other guys, did a great job of heading to Boston and getting some very specific funding that hadn't been in place back in 2008. That has helped tremendously. Put that aside, what we hit was huge years of inflation, and I don't need to tell you folks, because you see it in every single area of the budget. Everything has gone sky high. Everything that had one cost 20 years ago is now hugely more than it used to be. So here we are now with 3 phases, and 3 phases aren't done. We'll be breaking ground for phase 3 very shortly. But for the first 3 pages, these graphs will just show you the darker blue is phase 1. So that has taken care of, you'll see on this map, the first, the graph rather, Nauset Harbor, Rock Harbor, Pleasant Bay. These are the 3 watersheds that we have an obligation with the Department of Environmental Protection, DEP, to do nitrogen removals for Orleans. So phase 1 took a pretty good chunk out of Town Cove, out of Nauset Estuaries. May well have finished Rock Harbor. Not quite sure yet, because that's whatever happens further with Rock Harbor will be phase 15, way down the road. You don't see it at all on Pleasant Bay because phase 1 didn't include any of Pleasant Bay. But now along comes phase 2, which is the light blue. That's Meeting House Pond primarily. And so now we get a good start on Pleasant Bay with the reductions that are needed there. The green is phase 3 and what will be accomplished with the hatched lime green area. Again, a little chunk of Nauset Harbor, primarily Pleasant Bay. Through that phase 3 then, and adding to it phase 4, we're looking at about a 50% completion of the nitrogen reductions that we need for the town, which is pretty good. I mean, I wish it were 100% and not 50%, but when you think about how long it took us to get this far, it's not bad. We can kind of not just pat ourselves on the back, but say, good from the standpoint of financially looking forward. I know the question has come up and has been answered, I think, very well by Rich Waldo last evening in terms of why do we not want to delay? Well, that's also to the question of why don't we want larger year phasing? So right now, after phase 1, everything we're really focused on is Pleasant Bay because that's where we have the obligation to get those nitrogen reductions done. We're on a time limit now with DEP. We have committed to completing those nitrogen reductions by a particular year. We have already gotten really 3 permissions from DEP for delays. The first was right off the bat that I already mentioned, that initial wastewater plan that got pushed back, pushed back, pushed back without anything happening for more than 10 years.
Excuse me, what's DEP?
Department of Environmental Protection. Sorry. Well, I'll try to remember to keep repeating that so that everyone understands what DEP is. Department of Environmental Protection. That's the agency that oversees everything and anything to do with wastewater in Massachusetts. State agency.
And it's a state agency.
It is a state agency, correct. They do work with EPA, Environmental Protection Agency, which is a federal agency.
I know, I was in the Coast Guard. That was,
Okay, but primarily, everything pretty much in the Commonwealth of Massachusetts gets funneled through the State Agency of Environmental Protection. So that's DEP. No, I lost my train of thought completely.
I'm sorry.
No, it's all right. I shouldn't be that thrown.
So Judith, I think you were talking about the Pleasant Bay and how we are really
Pleasant
focusing
Bay,
on
thank you.
Pleasant Bay.
So that first delay, as I say, was that first original plan getting from 6 phases. When we get into this, our current plan, it's now 16. So we took those properties, that footprint, that area, those numbers of places that needed to be sewered, and instead of having it grouped into big chunks of 6, we said we're going to make it tiny bites. Now, everyone's idea of a tiny bite is different, but 16 phases, I mean, you take that number and divide it by 16, you have far fewer places than you do when you take that number and divide it by 6. What that did, and that's why I've got Alan here, because he does a much better job on this. What that did is enable us to have a longer period of time, which is advantageous, clearly. It also enables some of the debt to be paid back before we incur additional debt. So it evens out. Instead of being a continual up bar, it evens it out more. And it's a much smaller per phase cost than the original plan would have been. Even if it's the same at the end of the line, it's shorter as we go along. For Pleasant Bay, the first one was that going from 6 to 16. The second delay then was when the Pleasant Bay watershed got underway, the starting year was going to be 2018. Well, by the time all the towns got their plans together, got it approved, the watershed permit got approved, et cetera, a few years had gone by. Places had started, but really hadn't gotten fully underway. We went back to DEP and we got them to push that start date back from 2018 to 2022. So where you've got 20 years to finish everything, that gave us an extra 4 years. The final delay then was a couple chunks of Phase 2, Meeting House Pond, that didn't get picked up in the initial phasing, that if you all recall, went to town meeting, got approved. It was too late for the state revolving funds, so we weren't going to get those under the state revolving funds. We pulled them back and delayed them because 0% interest is huge. Did not want to go forward on that. But that, again, is seen by DEP as another delay. So DEP loves, Department of Environmental Protection, loves Orleans. We have been highly cooperative working with them. They have found it very, very helpful and beneficial working with the Pleasant Bay Alliance. The fact that Orleans was willing to partner with Harwich, Chatham, and Brewster and make it a watershed permit instead of just doing things town by town by town. The fact that we're willing to look at the possibility of nitrogen trading and other things that the Department of Environmental Protection would really like to see to be able to do a better job at a cheaper cost. All these things, they love us. That doesn't mean that they're going to keep on letting us delay, delay, delay. They've given us the 3, they're not going to give us more.
So Judith, you said we had 20 years.
Yes.
So that's 20 years from 2016 when we,
No, 20 years from 2022
20 years from, so we can go till 2042.
for Pleasant Bay. Okay, and that's just for Pleasant Bay. And of course, the Department of Environmental Protection is for the entire town. But right now, Orleans only holds a watershed permit for Pleasant Bay.
Can I ask a question? The The bar charts here are Orleans goals, for example, Pleasant Bay, or is it all the towns?
No, this is just for Orleans. But being someone who lives in South Orleans, anyone else that lives over around South Orleans and ventures often into East Harwich, oh my goodness, you know, we can celebrate, because just the way we've been torn up for sewer work, all of East Harwich is just torn to shreds. They are really doing a job of sewering East Harwich. And that is a benefit to all of us in Orleans, because that is the watershed to Big Bay in Pleasant Bay, which is the area that is used by most people for recreation in Pleasant Bay. So again, where you've got lots of different towns that are living around and utilizing any given waterway, it's really good to see that all the towns are doing what they need to do, and this isn't all on the back of Orleans.
Going back to the bar chart again, if we look at Nauset Harbor, that column, looks like about 1,800 kilograms per year coming out of Nauset Harbor after Phase 1. Is that in theory, or has it been tested and proven?
So for the Phase 1, that is, I want to say a tested proven, yes, that we're going to be pretty much able to test prove, because we do test what goes into the wastewater treatment plant, what comes out of the wastewater treatment
Do
plant.
you go out and wade around in Nauset Harbor, get a cup of water out and test it?
Yes, we do, but that's not the way you determine
How do you
nitrogen
know it's
reductions.
working, other than theory?
Well, because again, you know what's going in, and then you know what's coming out. The difference between the two is the amount you have reduced.
But you have other sources of nitrogen.
But this is only intended to address wastewater. This,
Cut
the,
cards.
I know.
How do you test it? How do you know it's working? That's all. And over what time period will it take?
So are you asking, I think what you're asking is, how do we know that reducing nitrogen inputs by a certain amount will accomplish the goal of improving our waters?
Well, with one nuance,
Okay.
2,800 kilograms per year. How do you prove that? I guess in theory, you can say if I put less in, I don't know what you can say. Yeah, there's less. No, there's not.
So
The other thing you have to factor in there, I
So
think,
there was the Massachusetts Estuaries Project, which was a huge study that the Department of Environmental Protection paid the School of Marine Science and Technology, which
SMAST.
is UMass Dartmouth, okay, SMAST. You may often hear SMAST. So DEP paid SMAST to conduct this enormous study of 86 estuaries throughout southeastern Massachusetts in order to determine how much nitrogen needs to be removed to return waters to good water quality, which was defined as approximately that level of nitrogen that would have been there in the late 1950s.
Is Nauset Harbor approaching that level? Have you tested it to say, where am I?
one of the
So-
things you have to factor in there is how long it takes that nitrogen, just like, isn't it like 10 years? Or
So nitrogen moves with groundwater, which is approximately a foot a day. So depending on, so if you've got a septic system within 300 feet of an estuary, that nitrogen, once you close down that septic system, that flow from that house is done in a year. And
The
you can
residual on
then-
the land.
But it goes back, and you can go 10 miles from some estuaries and have contribution.
All I'm asking is, we have the theoretical goals that we have.
Right,
Are you testing it?
yes.
Have you proven that the theory works?
Yes.
Where do we stand in Nauset Harbor today?
So now I will back it up to say the Mass Estuaries Project for Nauset Harbor did not give us a total maximum daily load for Nauset Harbor. That's something that still has to be established, and we've just had a meeting with DEP to talk to them about how do we go about, what's more is going to be needed in order to get that particular thing. So these are estimates from the first study. They are not for Nauset Harbor and Rock Harbor. They're very good for Pleasant Bay, because we've got all that. For the other two, we still have information to obtain.
What about Eastham?
Eastham is the same.
I mean, are they doing anything?
Oh, they absolutely are. So Eastham has started their first phasing, and they are doing a combination of SOARS and a PRB. But it will be, well, and they're doing other things north with Wellfleet, but down where we, quote, we care about it, would be Salt Pond and Nauset estuaries, and they have started things. We will be working with Eastham to establish those total maximum daily loads, both so that they can split the cost of studies, as well as making sure that both towns buy into what their obligation for reductions are, and to make sure that both towns are doing what they need to do to clean up the water.
And Judith, where do we stand with, oh, I'm sorry.
Go ahead, I'll ask you.
I was going to just ask, where do we stand with the, you know, the hookups for the first two phases?
For the what, I'm sorry?
The first two phases.
So
What,
phase one, I think there are perhaps 2 properties that haven't connected to the wastewater treatment plant
Wow.
from phase one. It's
two of how many were there initially?
300 and some.
Okay,
It's like
that's great.
99.999. Phase two, the letters to connect just went out or are going out Tuesday.
Okay.
John Nelson tells us that he has got 100 applications from people in phase two,
Great.
all approved and ready to go. The minute that they get their letter saying connect, boom, those contractors are going to be out connecting them to the sewer line. And we would expect the rest to follow very quickly, because we're,
And how many in total do we have in phase two?
I should have that
connections?
number, 240?
So this is a big number, you know.
Oh, yes, yeah, these are big numbers, which I think is why when you look at this and see phases 1, 2, 3, 4, that they accomplish a great deal.
Yeah.
What we will continue to do ongoing, including Pleasant Bay, I don't think there's a chance that we're going to ever get DEP to say, take more time. I don't think, that's just not going to happen. We are looking at, and we continue, as we approach each phase, we look at, is there anything we can do to shrink the sewer footprint within this phase, to find other alternatives that can pick up some of the nitrogen so that it doesn't all have to come out by sewering? And are there, time has gone by. The Mass Estuaries Project was done in the early 2000s. Will have things changed? And is there better information on certain things? So as an example, Center for Coastal Studies just finished doing mammoth studies of all of the salt marshes within Pleasant Bay. Might say, who cares? Salt marshes are unbelievably good at attenuating nitrogen. Attenuating means taking it up, getting rid of it. We think there's a chance that the number of properties to protect Poche Inlet is going to be significantly reduced. Perhaps even to be able to combine 2 phases there to 1, or maybe even eliminate it because of additional attenuation studies. George Messervy's been pursuing getting grants to do those studies to be able to look at that number better. Then you go back to DEP and say, hey, we said and you agreed and everyone was on board that we're going to have to do these 2 areas of Poche Inlet, but now look at this, we don't have to do it. And that's great, we're done. We don't have to do those now.
Tony?
I understand, and in the past few years, I've been reading, and I'm obviously not an expert in it, but there are a lot of new ways to keep urine out of the system, out of the waters. And I'm wondering how much the committee has looked at and seriously looked at and maybe and why have you rejected other alternatives to capture urine in the houses?
So yes, we have looked at virtually every single thing that's out there, and the other thing that we do is we look at the cost per kilogram of nitrogen removed. Okay, because that becomes the most important thing. If you've got to get rid of 5,000 kilograms of nitrogen, you want to make sure that you're paying the smallest price per kilogram to do that. So there are other systems, other approaches, other ways out there. Consistently, the most reliable, least cost is sewering. And that's a whole discussion for another night. I mean, I don't want to shut
Yeah,
that down, but that's,
I agree.
Let me remind you, Tony, we have talked here about fertilizer. So don't forget, just controlling that is another alternative that you're going to hear, we're all going to hear more about.
Tonight, we're
Sewers
focusing
don't
on
work on
wastewater, and Judith, to
This
your
is
point, this is
wastewater.
not about alternates, this is what we've
I
committed to
understand.
with our Phase 4.
I mean, I love talking all
Phases.
this stuff, but you don't want to listen.
Yeah,
Judith, what are we seeing as a result of the oyster, the oyster strategy?
Oh,
And,
so-
and I understand there's been considerable studies, I think at UMass Dartmouth, in regards to what we always called horse mussels. I think they're the striped mussels that are phenomenal at reducing nitrogen.
So we'll continue to look at, and there is going to be, hopefully, there will be an article to get some funding for trying and looking into further doing oysters in Mill Pond. But in terms of where we are already for the oysters that we're doing in Lonnie's Pond, it's a good example of as we come to a phase, we look at how we can do other approaches and different ways. This was one. We were able to sewer, I think it was 25 fewer properties in Phase 3 because of the oysters. We had solid data for how many kilograms of nitrogen were being reduced by those oysters, and because of that, we could do that equivalent number fewer houses for sewering, saved millions of dollars.
It saved millions of dollars on the run of the sewer lines, or in
Well,
total for the individual homeowners? I mean, does that reduce
It reduces the
volume that's
town-
necessary in the ground
Yes, it
with-
reduces the cost to the town. I mean, every foot of pipe in the ground is cost.
Right.
So even though you've got now this sort of donut hole of homes in the middle of Phase 3 that aren't getting sewered, yeah, there's pipes going around them, and there's still the wastewater plant, and, yeah, that still exists.
Right, right.
But the cost of the pipe to get to those homes,
That's my point.
yes, that's what you're saving as a result of this.
Right. And that cost is on top of the town's cost. That's to the individual homeowner to get to the.
Right, yes, the homeowner does get, yes.
So
We all know
I guess
sewering-
if I'm hearing this correctly, I couldn't claim that the use of oysters to reduce the nitrogen is cutting back on the infrastructure that's costing the town, correct? No?
Yes, it's cutting back on,
Right.
yes, infrastructure is pipe in the ground,
Right.
and it's cutting back on that.
Oh, okay, I thought you said it was cutting back on, because I thought you said it was cutting back in terms of the individual homeowner hooking up to what's necessary to
no,
service
no, no,
the
no.
other. Okay.
No.
Okay.
So, the footprint just got redesigned, so
Okay.
there's an area in the center where pipe does not go.
That's good to know.
It was sized so that should it need to go in the future, it can. So we don't go back and dig up roads all over again should something need to be expanded 100 years, 50 years, 75 years from now. But it absolutely saved money now.
Thank you.
Sure, David.
I didn't want to interrupt, so do you have more presentation to do? Because we sort of
No,
jumped in on you.
I was just going to ask Alan to jump in on
Okay.
things like cost.
If you're,
No,
that was
I'm
terrific what you
done.
did. Oh, that's terrific, Judith.
Yeah, because cost and how this.
And
gets
exactly, so
financed-
now let's switch over to Alan and his analysis of cost going. You've done so much work on that, Alan.
Yes. I have kept track of this since the beginning, and I will tell you that there have been 20 debt exclusions taken by the voters of this town to move this sewer project forward. 20 of them. I have every one of them on a list, and with only one or two cases, did less than 70% of the voters who went to the polls support these. So it was about a 2-to-1 exclusion vote every time we went to the voters. So they understood that this had to be done. Now, Elaine, I think you said 130 million when you started? Well, okay, let's take 130 million and let's ask ourselves what it really costs the town.
Exactly.
So yes, we have voted debt exclusions up through last year, I guess, when we voted for phase 3, of about $130 million. About 10 of that wasn't qualified for any state aid because of when it was done and how we did it. But as you know, in 2016 to 2019, I was involved with a group of about 7 people here on Cape Cod, Chamber of Commerce, APCC, state senators, former state senators, and others, to try and get a short-term rental tax adopted for Cape Cod. It had been tried by individual communities for 10 or 15 years, and it never happened. And it became an issue that we decided we would push for. And on December of 2018, between Christmas and New Year's, I got a telephone call. I was out in Seattle at the time visiting my daughter from Rich Delaney of Center for Coastal Studies saying, the legislature just passed it last night. It had not been passed in the regular session, but they were an extension. And all of a sudden, we were in a situation where there was new money coming. And I was on the select board at the time, having spent at that time 50 years in local government in Massachusetts, realized that there was going to be some new money coming in. We didn't know how much it would be. And I suggested to the select board at the time, and it was voted by the select board, that any of that new money would go into a special wastewater stabilization account.
Yep.
We were the only community on Cape Cod that did that.
Yep.
Other communities did nothing, and then what happens, it goes into free cash, and the town managers or the administrators get to recommend how it should be spent. So we have a dedicated system right now. The combination of the 6% tax on Airbnb and the increase of 4% to 6% on hotel motel for the last 3 years has brought in about $1.7 million, which is dedicated to retire debt and take care of expenses with the wastewater.
Is that per year, Alan, or?
Per year, it has come in. It comes in quarterly, and
No, it's $1.7 million per year
that's correct.
in the past 3 years.
Yes.
Yeah, okay.
Actually, a little more before that. But anyways, now, in addition to that local fund, we also succeeded in getting the Cape Water Clean Water Trust, so that 25% of all of the Airbnb rental receipts on Cape Cod go into a Cape Cod Clean Water Trust Fund. That pays for 25% of our project. Now,
That's where it gets really confusing.
it is money that is used to pay for 25% of our debt service. So if we have $130 million out unapproved, not floated yet, but approved,
Yeah.
you can take 25% of that and say, we will never have to pay for that from the town of Orleans,
And it's being paid by the county.
being paid by the Clean
by that
Water
county
Trust.
tax.
Yes.
Yeah.
And it's done through the state treasurer's office. We never see it, but we have to pay the 75% that's left. So take, in rough terms, because there's 10 million that was not subject to anything, let's take 120 million, and we will have to pay 90 million of that 120. The rest of it is covered by the state revolving loan fund. The other thing that I was involved in prior to this was in the late, just before 2010, I was involved at APCC, who was involved in this. Rob O'Leary, who was our state senator, was successful in getting the state revolving loan fund to provide zero interest loans for projects that focused on nitrogen removal. And the plan in Orleans is all focusing on nitrogen removal. And you have to meet 5 criteria to get that money. George and I worked very hard over about 10 years to make sure that we qualified. And in 2020, as I remember, we were given 0% financing for our downtown system, which was 58 million, less 25%. So 44 million, as I remember, is 0% financing. Now, it is not financing from the open market. It is if you have a project that is in the state revolving loan fund, and this is what Rich was talking about last night with the timelines, and I'll go for that in a minute. If you were a community that had a project that was approved through the state revolving loan fund, and all of our projects have been approved that way, you then have the right to charge, or you can charge your bond rate at 2%, not the free market, because the state is providing a subsidy. The town of Orleans, through our housing efforts, also qualified for an additional 0.5%, so that technically, if we had not qualified for the 0%, our bond rate would have been 1.5%, not 4% or whatever the market is. So the savings that we have obtained by going from to 0% is the difference between 1.5 over each of those bond issues and 0%. And you can run it out sometime on the calculator. It's real money. The last thing that was done, and this was part of the original wastewater management plan, which was approved by the state in 2011, was there was a question during the planning process of how or whether you should have betterments charged to the people who connect to the system. And Wright Pierce did a very extensive analysis showing that there was a benefit to those people who tied into the system. Over time, they saved money, as opposed to staying on Title V and replacing their system every 20 years and pumping it on a every 3 years basis. So there was always a provision that there would be betterments. And we had an extensive discussion in 2019, 2020, when we decided that betterments would, the select board decided that betterments would be charged to those people who were connected to the systems in downtown and Meeting House Pond. That was the extent of their decision. So that took another 10% off of the cost to the general tax rate in the town.
20.
What?
Well, it started out at 20, but we settled for 10.
No, it's
And it's 20, I think it's 20.
Is it 20 still? Is it?
It's 20.
Okay, it's 20 then, okay.
Okay.
So my memory failed me. That's easy. So anyway, so 25% from the state revolving loan fund, whatever the savings are from going 1.5 to 0%, and betterments. And we started out on this project with an estimate of $250 million in the wastewater plan. If you looked at that money today, given inflation from 2011 to today, that cost would be about $363 million. And we're partway through this process, and if you take everything into account, we're less than $100 million.
So,
It's not bad.
so going forward, is the formula, are we assuming that the formula for this financing will hold?
Yes,
all the bits and pieces.
yes.
So do we have any sense of what the betterment will be going forward?
That's up to the selectmen and the Board of Water and Sewer Commissions, and I'm not involved in it
No,
anymore.
I understand, but, you know.
I don't know.
Are there any
There is
discussions?
a consultant that's working on it.
Yeah, I don't know what they'll do.
Because that's 20% of whatever reduced costs,
Yeah,
yeah.
so I think it's important to understand that when we started out and the voters approved this plan in 2000, the draft was 2011, as I remember, we were looking at a $250 million project. Those dollars at that time with no aid of any kind. And the last thing that I want to talk about is, since I was involved in this from almost the beginning, I didn't retire in 2003, so I had something else to do, but I have been concerned about how you pay for this significant capital expenditure, which is required to make sure that Orleans remains in its competitive position economically. People want to come to Orleans. There are other communities closer to Boston that people don't go to anymore because you can't swim or you can't use the beach and so forth. So we have to make this investment. And I became concerned because I was involved as a select board member and then on the wastewater planning management committee, that it would be impossible for us to meet our obligation to do this project in 20 years. The hit every 3 years would be significant. And so I pushed, and we had the opportunity, because we changed the location of our wastewater discharge, to do an amended CWMP. And when we went through that process, ending in 2003, I think, I pushed for, and the wastewater planning committee said, yes, we got to do this, that we go to 16 phases instead of 6 or 5, because we get a chance to spread it out and we make sure that its share of the annual debt service in this town is reduced. It goes longer, zero interest, but it goes longer. Yes, there will be CPI improvements in cost, but one of the things that I've noticed is that the income from the Airbnb money, and particularly on the motel side, which is about $400,000 a year, increases with inflation. It's fascinating to watch what's happened. We have closed 150 with Governor Prince and Seesaw, 150 motel units in this town, and our 6% money has gone from something like $330,000 a year to over $400,000 a year. So there's a demand. The use of the remaining motel units has increased. Those people have ended up being winners because they're renting more rooms. But it is money that increases, and I think the Airbnb money will increase as well over time. Just gets more expensive to rent, which means it's more expensive at 6% that comes into our coffers.
Now, going down to a little bit closer to the weeds, for example, in Phase 4 project's timeline, you say that the order to connect is in 2032, okay? Is that when we actually go to the market and borrow funds and switch over to bonds?
So the bonds are actually floated by the Commonwealth of Massachusetts under the SRF program. We don't float them. And generally what happens is your first payment on a project comes at January or December after you declare substantial completion.
So basically, it'll be either the end of 32 or the beginning of 33, according to the schedule. I mean, there's a little green line at the right hand that says order to
Order to
connect.
connect.
Yeah, you will
So
act- you will
that would
actually-
be 2033.
Yeah.
Yeah.
Yeah, but the first payment, the first payment will be before you finish, so it'll probably be in December of 31 or 32. The first payment will come before people are directed to hook up,
Okay.
because the project will have been built to the point where the state has spent 90% of the project cost.
I
They
see.
want to start retiring the debt.
Okay.
Speaking to the deadline, make sure you see what's on the back of this. It's 2 pages, because this reinforces the essential vote at this town meeting. These are the kinds of things that have to be done to keep this on track. That's why we are voting for the funding at the May town meeting, not delaying that. Because if this work isn't done, if this were delayed until the fall town meeting, then the entire project schedule is thrown off
By a whole year.
by a whole year. So it's
Thank you, John. Yes.
it's of
that-
the utmost importance to realize that there may be discussions, and I think you'll even hear people say that this later can be an adaptable plan. But this is a critical vote, because in order to have the kind of precise information to go out to bid, this has to work has to be done. So I think
Yeah.
people
This
thought
is the
last-
first
yes.
piece, and all these things that are listed here are what's funded by that preliminary design.
which
Yes, and that is
can't be
exactly
delayed.
what builds then the bid, the estimated cost that gets submitted for the state revolving fund application. So the approval, it's a long approval process, basically. You've got to have all that information in hand before you can come up with that price that you're going to submit and say, we would like to be considered for this. Then they get the time to work through it, while we get the time to do the final design. And then after that is another year, and then finally you're voting to fund the actual project.
Do the design costs, do we get to bond them at 0% when that phase is completed?
I don't think the bond, the design costs are not subject to 0% finance. That's a local cost.
That's a local, so you can't capitalize your
No,
design,
no.
unlike we can do with the fire station. The $4.5 million we approved last year, we'll be able to capitalize and put into the bond.
Yeah, well, but the issue is that we have to finance the design work ourselves. The project itself is paid for, the capital part is paid for by the state, so they're separated.
Two projects.
Where in the fire station, it's one place.
Unfortunately, we're not, yeah, okay, so we're gonna have to, the money that we authorize for design
Yep.
is out of our pocket.
Yep.
And it's at 100%, and it's interest-bearing.
Yep.
Okay.
Just one other thing, I appreciate John mentioning this side, but I want to go back to the chart side. Every date that's included on that side is absolutely critical that we meet through this project process. Because if we miss a date, we stand a chance of losing a year.
Could I ask a question? Yeah. This is, by the way, extremely educational. Thank you. I really appreciate it.
I didn't throw away all my files. Went up in the attic.
Goodness, thank goodness. Could I ask a few questions? Because it sort of helped build the context to what I think the concern of some of us is, or probably all of us, is the, at least on our part, the lack of knowledge of what is the debt going out. So we got the other night, nice explanation through 2031. And so we've asked questions, and I think Darren is going to get us answers hopefully very soon as to, what is the schedule and what are the assumptions that are involved in that schedule. Because there's betterments, there's 0%, there's the 25%. And so I think in the bigger picture financially, at least I'm really curious, to what extent do we feel that it's reliable that the 0%, and I know they're completely different, but the 0% rate will continue going forward? because I've been told that is the assumption for the operating projections, which we haven't seen yet. But what is that, and what is the understanding regarding the reliability of the 25%
Okay.
subsidy?
All right, let me
More
go.
after that, but I want to get.
Okay,
yeah.
let's start with the big ones.
Get the fundamentals.
Yeah, so 0%, in my opinion, is locked in. The state is not going to change that. And I know that the whole SRF funding process has been, it receives federal money on an annual basis. And there's a question whether or not are they going to get money this year or next year or whatever's going on. But what they have done very carefully is use their capital in a way, and they're getting paid back because not every project gets to be 0%. The only projects that get 0% financing are those that are removing nitrogen. And when you look at the SRF program for the year, there are probably 50 or 60 projects that get approved. And generally speaking, the only ones that can get 0% are the ones on Cape Cod and Buzzards Bay. Because the other projects are just traditional sewer projects, upgrading the MWRA or something like that, a pump station. They don't get 0% financing. So I'm pretty sure that it's going to stay because it is a relatively small part of the total SRF capital plan.
Okay.
Now, as far as the Airbnb, is that going to stay? I'm convinced that will stay too. Boston and one of the problems on Cape Cod is that we are a relatively small population, relatively small legislative delegation. And that's why we can't change school funding formulas, because those formulas are driven by Boston, Lawrence, Brookline, Chelsea, Cambridge, Somerville. They've got all the legislators that control it. So they also make a lot of money on Airbnb. So nobody's going to take that away. Now, what the Cape and Islands Trust has done, and this is sort of unique, is the Treasury Department, state treasurers, was operating on the provision that they might run out of money because they were only using the cash that was coming in. And what they were finally persuaded to do a year ago is use that cash to pay debt service. So there's a much larger pool of money that can be used to reimburse the cities and towns on Cape Cod. In the environmental bond bill, which I think is something that may get passed sometime soon, there's another $350 million of state money that's going to go into the Cape and Islands Trust. Because what has happened is the costs of doing the work on Cape Cod has increased significantly. It started out, Judith, about 8 million. Then the Cape Cod Commission did their study. It dropped to 4. Then we go through inflation and everything else that's been going on in this world in the last 10 years. And now we're up to 5 to 6. We experienced that the first time with our plant. That was during COVID. And remember, some of you were still here then. During COVID, we couldn't get bids because people didn't know how they could get the parts from China or Germany or wherever they came from. And then finally, when the bids were opened, we were $12 million short. And we had to go back to a special town meeting in June of 2019 to bring that money in, to do the job, to make sure that we met the deadline of June 30th in order to get the state money. So I think the sources, now, as far as zero interest is concerned, there is one way that this town could get itself kicked out of zero interest.
Not reducing fast.
You can't change your zoning to be more intense than it was when the original plan was adopted. And we have not done that. We have not done that. George and I worked very carefully to make sure that the downtown plan, including this zoning amendment, did not put us in a situation where we would lose that money. But if you decided that you wanted to rezone other parts of Orleans in later phases, so South Orleans, for example, you want to turn it into a village center, you'd have to change the zoning there. You might find that you then have increased the density there and no longer were eligible for zero financing for that particular program. Now, I don't think we want to do that, but that's something that the planning department and other old planners looked at through this whole process. We went through an extensive evaluation of downtown zoning to make sure that we didn't kick ourselves out of the zero financing program. And we haven't done it at Meeting House Pond either.
So this question is probably because I don't fully understand it, but with the 0%, you don't believe that it's an adverse impact that the rest of the Cape is following us, and there's going to be
There are other
be a
communities.
lot more demand, I think. right?
Competition.
Yeah.
Well, for the 0%,
Yeah.
I don't think that's a problem. I don't think that's a problem.
Okay, that's what I'm asking.
Yeah.
Yeah. So in the betterments, I guess the assumption is it's 20% that are going forward. I guess we're going to wait for Darren to give us some projections.
Yeah, I think that's,
They haven't voted, Phase 3 hasn't voted the betterments.
I know that. But there's assumptions that they've used that they told me they've been using 20%
yeah.
as a going forward. So we'll get that in writing, so we'll understand what that is better then. So I do want to go back to something Judith had, if I may, had mentioned. I know we're talking about the finance. I'm thinking of the money, the bigger picture. The town's projected cost is about $950 million, beginning to end. And that, so the concern I have is that when you had said that sewer is by far cheaper than any other alternative, as you know, I've talked about, urine diversion as an option. I'm looking at this financially, and I'm wondering, and you don't have to even answer tonight, but I just to get it out there, that given the cost per kilogram for urine diversion is about 1/6 of what sewer is, given that it can be highly effective if utilized, and we know it's still in pilot programs, I'm wondering if you guys would ever seriously consider, because I've seen really no encouragement in that direction yet, but I'm going to keep trying, that we can invest some actual money in doing a pilot program. Falmouth is doing one, Martha's Vineyard is setting one up right now. The word this past week is that the toilet apparently is about to be approved. The word is late April or May. Of course, they said that last year too, but it appears as some things are coming together. Would you, given the huge dollars at stake, and that's all I'm really talking about, it's huge money. It's a lot easier for me to flush the toilet too, that you would consider actually supporting something like that. And you don't even have to answer, but I've watched some of your meetings and I see that it's just sort of not engaged with, and I think it's a mistake.
If I could comment on that, because I'm not part of any committee right now, which gives all sorts of freedom. I have been following Falmouth for 15 years. It's taken them 15 years to get to the point where they're about ready to do this project. I don't think Orleans needs to do a special study here. Let's find out what happens in Falmouth. If it's approved in Falmouth and we understand what's involved, then we have an adaptive management program that will deal with out years, then we do it. But you don't have to worry about spending money now to do a test here. You want to see if the technology works and let Falmouth pay for it, and the vineyard.
And we didn't do a whole, of course, not a whole pilot program or anything like that, but we did, it was further considered, the urine diversion, the IA, et cetera, as part of shorter-term solutions for Mill Pond.
I know.
So that information is available on the town website, and anyone who's interested in, the pros and cons, the why, the costs, et cetera, can go look at that material. That would be helpful, I think.
So I'd like to bring the conversation back around to why we actually asked you both to join us this evening, which has to do with we are still wanting to know that 2030, 2031, what is the sewer debt going to be costing us? And it's complicated. I can see how complicated, I think we can all see how complicated it is. 130 million, deduct this for that, 0% financing, add in the 20% betterment reduction and so on. But because I see Darren online there, I think I would like us to maybe agree, make a short motion that we'd still like to get those figures. I mean, what you're telling us, I think I'm getting the understanding that we've got to keep going with this train going at this speed. But where we are going, wait a minute, is how these different huge expenses are going to be impacting the town. When you talk about affordability, adding a couple $1,000s to every $1 million property per year, that's a lot of money. So anyway.
I would make a motion that we absolutely need that data, so however you
Yeah.
want to word it.
So what
And
will,
we've been waiting for it, and
what would happen if we don't get it by next week when we have to?
Yeah,
set-
that's true.
I mean, we have to vote on this thing at the latest by next Thursday. What we will do with the information if it comes on Friday?
Well, I think this is the opportunity to answer your question. I think it is the opportunity to, because we've asked for it and haven't received it. So I'm thinking, well, I don't think it's so what. I think it's important to know that we know what they've projected through 2031, which doesn't include a library. And so when you look at it and you say, well, what is 32 when they say that's just, the debt is just starting to hit in 2031? And we don't know if this looks like it's 2032. I don't really know if it's included in Darren's projections for through 31 or not. If it isn't, they did say that's when it bumps up. So our question is, my question is, what happens 32, 33, 2 and 3 years out? Because they're 30-year bonds, correct? And you're going to have a bunch of them overlapping. So it has to be a schedule out there that tells
And
you,
we're not saying you-
that shows you just the sewer portion.
We just want you to understand, this is the
Right,
question.
no, I understand
We're
what you're
asking,
asking.
There's
you know,
Darren.
And I wish I could give that to you. I can't give that.
I know,
not
I know,
your
I know,
job.
but he was asking, why are we asking the question? That's
No, no,
all. I
I'm
know it's not.
not asking why we are asking the question. Listen to me. Why do we need to have a deadline for getting that answer before we vote next Tuesday or Thursday?
I don't think anybody said that.
But that's what I understood. We need this thing to make a decision.
Why don't we ask Darren?
you don't feel we do, Nick?
No.
I think there's a good chance they may not, I don't know, Darren, can we get you
We're
to,
talking about, first we're
Opine about
talking
this?
about 2032. We might invade Afghanistan again by then. So it's estimates on estimates. Here we have a critical decision to make on continuing the ship on a course. There's phase 5 that's coming up later, which we could stop if we get really upset, you know?
Nick, don't you think that, I'm not suggesting that we stop the train, and I think we've gotten some very good information. But I guess I'm wondering if the commitment to this is going to impact our decisions on other aspects of projects that we're put in front of us and making. a
So
decision.
you're saying that if we don't get this number, you're going to vote against the fire station?
I feel honestly, I
way
feel
we
sort
have-
of been held hostage a little bit by some of this process, Nick, frankly. And I think one of my feelings right now is that the select board set parameters that were ostensibly the policy they were going to stay with in order to move the needle on the operating budget and the CIP. And that's we've already violated those policies.
I agree.
Just a moment,
I
just a moment.
I understand you. But what I hear is that we're going to make a bad decision for the town because the select board messed up with whatever combination of decisions they have committed to.
Nick, with all due respect, everybody's working really hard on this, including our town employees. I understand that. But to tell you frankly, I've been on this committee for like 6 or 8 months? And the last time, for the last town meeting, we were in the same predicament with not having the data, not having clarity on some of the decisions, and being forced in a box to make a decision. Now, I can operate that way if necessary, but if I'm in a position where I'm supposed to be looking out for the welfare of the taxpayers. And I frankly, as I said last week, have talked to a number of people who are really feeling squeezed
So look-
financially. I feel a responsibility to get as much data and as much clarity as we can. And yes, you know, I heard Jeff's presentation. We all understand the predicament they're in. What my concern is I feel as though we are often in a position of being the issue spotters as opposed to the problem solvers. We've had numerous meetings with the select board
We are
where
not
we have
problem
put,
solvers. We are issue spotters.
hold on. We had numerous meetings with the select board that were ostensibly called workshops. We had, in my estimation, very little dialogue. We asked questions. Were they answered? No. I just don't understand how we operate this way. And that's, you know, and I have felt a bit of frustration building at every one of the meetings I've attended over the last month, and there have been numerous meetings, because, you know, look back at the policies, no new hires, right? Now, it's very difficult to say no when something's put in front of you that's needed, whether you're a parent speaking to your child, or you're a boss speaking to your employees, or you're working for the town. But at some point, if we can't see the real full picture of the impact on the taxpayers on the next tax bill, then I don't feel like we're really doing our job. And maybe I don't know what my job is.
It's not the next tax bill that you're talking about.
That's a bit rhetorical.
Alice has it spot on. Our charter says we analyze the financial implications of the town's financial activities, including budget and capital improvements, and we report our findings to the town's residents. Here's a financial, this is
a huge financial
This is a
decision.
huge, and it's been a long-term, huge financial, and I think we won't satisfy our charter if we don't have the financial information to understand what the financial implications are and to share our recommendations with the residents.
So we each have an opportunity to vote when we vote on the warrant articles.
And hopefully we'll have an opportunity to
This may
explain our
not
vote.
make you feel completely better, but do remember that Ed, 2 meetings ago, I think, gave a very, very positive report on pretty quick progress, right, Ed, of getting us in position to do much better financial analysis, answering questions like you have. I hear your report, right?
Yeah.
We're much better positioned to do that.
I agree,
know-
John.
I know that for tonight, that may not help, but that, I think, is a very good positive. So the other thing is, we did get terrific information about debt in the last briefing, which was, you know, significant. So
Yeah, the Scott Walker was excellent.
those things are encouraging.
They are encouraging. Scott's presentation was very, 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 very well done. And he expressed concern. You know, if you go back, I mean, I made notes, verbatim, he expressed concern regarding affordability in regards to the road we're on.
So let's, I think it's
I rest
time to
my
move
case.
on. Judith and Ellen, thank you very much for explaining what you have with us. I think what you're seeing is the kind of, what I'm trying to think about is, I don't want this kind of conundrum being on town meeting floor. And if you hear the passion right here, you know, we need to have our ducks in a row about how we want to be presenting these issues to the town.
And it's something that we're all concerned Absolutely.
Elaine, thank you. I want to just add 2 things before I leave, and it's been a pleasure for me to be before you, just as an old citizen. That's fun. 2 things. First of all, the finance department here can tell us what the bond costs are going to be, given the issuance of every bond issue that's been issued, okay? They can project what it may be in 2031 based on a lot of guesses. Like we have bids coming in on phase 3 on the 20th of April. Does anybody want to guess what those bids are going to say? I don't think so. And the other thing that you need to think about, if you decide to pause this year, you've got to ask yourself what this costs the town long-term. Because you pushed everything back a year, that's another year of inflation for the next 30 years, each year, and it's a negative. And the last thing I would say is, I said there are about 50 different towns that are listed in the SRF every year. The town of Orleans, because of the way collectively we have dealt with this issue over the last 20 plus years, has always scored in the top 5 or 6. We are respected for the way we have dealt with. And Judith talked about the Pleasant Bay Watershed Plan. Ironically, in 2016, the Federal Department of Environmental Protection Regional Office gave the town of Orleans an award for the way we had done this from a national organization. I mean, there's a lot of thinking that goes into it. It is not simple, and it costs a lot of money. But the alternative is not doing it and being charged through the Conservation Law Foundation or somebody else. We're not proceeding, therefore we'll take care of it. We lose zero interest financing, we lose everything. And we can't afford to do that. I mean, it's a big hit, but we've got to think about where we want Orleans to be after everybody in this room is left. Because the next generation and the next generation loves this town as much as we do. And it's up to us to take care of it.
Yeah, that's a wonderful message, Alan, and I am very impressed
So
with
thank you very
hearing
much.
what you folks have done over the years to put the financing together.
But anyway, thank you both very much for presenting with us tonight. Very
Yeah,
educational.
Good luck.
Thanks.
Coming.
So I might suggest that we start working on some of the warrant articles. What do you think? I think we should get some votes out there, because I can tell you right away, we are going to have to meet again on April 2nd, because there are 2 items on here that are going to have to wait until April 2nd.
Phase 4 first.
So, thank you very much. I don't think so, Ed. Nick and I stayed for the rest of the Select Board meeting last night while we watched the votes that the Select Board was making about their articles. The first 1 through 15 is called the consent calendar, and 2 of those items, that gets voted in a single batch. Now, 2 of the items are temporarily taken out because we don't have any definition of what the language is going to be, and those 2 articles are Article 12 and 13. So without having those 2 articles in Article 1 to 15, I would entertain a motion to place and vote on the consent articles.
Sorry, Elaine, the 2 that are on hold are which?
12 and 13,
We don't place, by the way.
right,
Are we just voting?
Yes.
yes.
They-
So we need a motion. In fact,
I'll move all but 12 and 13.
And I second them.
and by roll call, vote, Chris?
Yes.
John?
Hold on,
Yeah, you do it.
hold on.
You do it.
It's alphabetical.
Ah,
Oh, Chris is here.
Yes.
Yeah.
Yeah, he looks pretty comfortable.
All right.
Recording clerk.
Oh,
This is 1 through 15 minus 12 and 13, right?
right.
Motion Ed and seconded Nick, right?
Can I borrow your pen? Fine, thanks.
You want to vote a second time, Chris?
Okay.
yes.
David Abel, yes. Nick?
Yes.
Elaine?
Yes?
John?
Yes.
Chris?
Yes.
Ed?
Yes.
Peter? Not here. Tony?
Yes.
Alice?
Yes.
That's it, right? That's it.
You know, Chris, there was a comedian who said he wanted to be buried in Chicago because he'd like to stay politically active.
Yes.
So the
Chicago's
next,
always,
I might suggest, just for moving very quickly, that, Ed, I will nominate you to say place of support, and Alice, you to approve, and then David, go around and take the vote.
To be clear, seconding or moving an article does not infer agreement in favor
Absolutely
or
not.
unfavorable.
No, no,
Okay.
not at all.
What are you wanting us to do again? I'm sorry, Lynn.
So you're placing support, you're moving the article, and David is gathering the votes.
This is just to place it.
This is not place and,
Don't place.
we don't
Okay.
place?
That's what I'm asking. Is it two votes or one vote?
The select
One,
board
right?
placed,
Oh, okay, thank you.
the select board has placed all these articles.
Okay,
All we do is vote. Okay.
all we do is vote,
Yes.
okay.
Yes.
Then, I'll read Article 16, Article 18, bills of prior year.
I'll move it.
I second it.
And David by roll call?
David Abel, yes. Nick,
Yes?
Elaine,
Yes?
John,
Yes.
Chris,
Yes.
Ed,
Yes.
Tony,
Yes.
Alice.
Yes.
All right. It's 8-0.
Then last night, the select board meeting articles 19, 20, 21, and 22 were combined. Those are that is the operating, did I get that right? The operating budget and the 3 enterprise funds.
I'm not sure I understand what we're doing.
I don't think,
They were combined last night.
the enterprise funds.
All right, then let's vote Article 19. So,
Could I make some comments about the enterprise funds?
no, let's vote on Article 19,
Can I
which is
just
the
ask
operating budget.
Elaine, a
We have a
clarifying
procedural
question.
question here.
Yeah, from a new member who, we are voting to do what? Agree to place these on the
No,
warrant?
no, I was wrong about that, Alice. We are, on these articles, we are moving to present the article to the, we are just voting yes or no on the article. So one person will say aye. Move the article for Article 19, and then it would be all in favor or not.
So we're voting in support
Or not.
or
yes.
not
Or
Yes,
not.
yes.
of,
We don't have any information about the budget of any of these three.
But we're not.
Yes, we
doing-
got them all.
Yeah, we do.
I think we ought to wait on that operating budget. Did we get a final after the changes from the school district?
We did last night.
We did, last night.
Where's Darren is up there?
Yes.
Can you hear us, Darren?
Okay.
The question is,
can.
did we talk about a final budget, as final as it could be,
Yes.
last night?
We did. I mean, we did finalize the budget number with school numbers included in it. So we are at that point now where we have a balanced budget without an override required for the school's new numbers. The only override in the operational budget that is currently there is the select board supporting a citizen petition for the COA position at a cost of about $139,000. That will be pushed to an override. So that's it. Those are the only two discussions last night on the operation. Subject to any questions, I'm happy to answer them.
Your motion?
I move that we vote on Article 19, fiscal year Town of Orleans operating budget.
I'll second it. Discussion.
Any discussion? Then by roll call?
Okay. David, yes. Nick,
Yes?
Elaine,
Yes?
John,
Yes.
Chris,
Yes.
Ed,
Yes.
Tony,
Yes.
Alice?
Yes.
Okay.
I move that we vote on Articles 19, 20, 21, which are fiscal year,
19, we just voted.
We just voted 19.
excuse me, 20, 21, and 22.
Yes.
which are the beaches, sewer, and transfer station enterprise fund budgets.
Let me get more paper out.
A motion to vote on those three.
Right, and we need a second.
Second.
And David,
Do you have any discussion?
any discussion? Sure.
I just have a couple of quick comments about the enterprise funds. I had a really good meeting with DPW and the enterprise fund managers. The Beaches Enterprise Fund was established to be a self-sufficient. That means its users pay all of its expenses several years ago. This coming year, fiscal year '27, the Beaches Enterprise Fund will operate at a $500,000 deficit. That's a 16% subsidy paid by the town. And so if we want to convert that to what does it mean to the average median homeowner here, that's about $80 that they'll end up paying for the opportunity to have the beaches here. The Sewer Enterprise Fund was also formed to be a self-sufficient enterprise fund with the users paying the fees. This coming year, it's estimated to operate at a $998,000 deficit. That represents 28% of their 28% subsidy that the town is going to cover. And that the cost for the average home in town is $158. The transfer station was the only enterprise fund that still exists that was set up to have an embedded 37% subsidy. For the fiscal year '27, the subsidy is going to be $504,000, which represents a 34.8% subsidy. So it is operating as it was intended. And that the cost to all median homes is about $80 a year. So just want to let you know that notwithstanding the user fees we pay for the beaches, for the septic, for the sewers, and for the transfer station, there are embedded costs
Yeah, that's terrific.
that make those expenses a little bit higher.
Yeah, thank you for that, Ed. Any further discussion? So by roll call?
This is 20?
20, 21, and 22.
You're going to do them together?
Yes.
Oh, okay, great. I'm going to save paper. Okay, David, yes. Nick?
Yes.
Elaine?
Yes.
John?
Yes.
Chris?
Yes.
Ed?
Yes.
Tony?
Yes.
Alice? Alice?
I'm going to abstain from this vote.
All right. I'm abstaining. Great. Thank you.
Article 23, adopt capital improvement plans fiscal year 27 to 31. Get a second? Please. I move we vote on Article 23.
I second that.
Any discussion? Okay, David, we can vote?
All right. David, yes. Nick?
Yes.
Elaine?
Yes.
John?
Yes.
Chris?
Yes.
Ed? Ed? Oh,
Yes.
okay. Tony?
Yes.
Alice?
Yes.
Okay. Thank you. That's 23.
I move we vote on Article 25, the CWRMP Phase 4 preliminary design for $2.7 million.
I second that.
Any discussion? David, well, I guess we vote?
David, no. Nick?
Yes.
Elaine?
Yes.
John?
Yes.
Chris?
No.
Ed?
No.
Tony?
No.
Alice?
No.
Okay, hold on, I'm sure I did something right here, okay. All right.
I move we vote on Article 26 to fund additional costs for Phase 3 Lakes Upon Sewer Collection System and construction. $2.5 million. Any discussion? There being none, we can vote. David?
Can I double check one thing first?
Sure.
Do we skip 24?
Yes.
No.
We did.
All right, good. I was doubting myself, sorry.
Okay, okay.
We
I'll come
had a
back to
problem
24.
last year. I don't want to do that again. All right, so we're on,
26.
26, then I'll come back to 24.
Right, all right.
That's my bad. My apologies.
Madam
I'm
Chair,
sorry.
we didn't vote 26 last night. We're still waiting for giving it some time. I believe we waited on 26. Is that correct?
I have not, I have 500.
I do too.
Yeah.
I know we voted.
Yeah, there was discussion, but you ended up voting.
What was the vote, do you know?
5-0.
Was there a second?
Yes, I seconded.
Okay. You ready to vote?
This is 26?
Correct. We okay, Elaine? Ready?
Yep.
Okay.
No discussion.
Let's see. Okay. David, yes. Nick,
Yes?
Elaine,
Yes?
John,
Yes.
Chris,
Yes.
Ed,
Yes.
Tony,
Yes.
Alice?
Yes.
Okay, thank you.
So now we'll come back to the Article 23,
4.
24?
Yeah,
Yeah.
that's the one I think we skipped.
24.
But you haven't voted on that, have you? 24.
I think we should wait.
It was voted on last night. I'm sorry?
I don't have my sheet with me.
Oh,
They voted on it.
yeah. Article 24, Fund Fiscal Year 27 Capital Budget. Get a
I move
second?
that we fund it.
Okay. Any discussion? Article 24.
Ready? David, yes. Nick,
Yes?
Elaine,
Yes.
John,
Yes.
Chris,
Yes.
Ed,
Yes.
Tony,
Abstain.
Alice?
Yes.
All right, what's next? Twenty-seven?
I move that we vote on Article 27, the cleaning and rehabilitating of wells number 7.
I'll second it.
Any discussion? Okay, David will vote.
All right, David, yes. Nick,
Yes?
Elaine?
Yes.
John,
Yes.
Chris,
Yes.
Ed,
Yes.
Tony,
Yes.
Alice?
Yes.
Okay, thank you.
I move we vote on Article 28, Fund Fiscal Year 27, the Community Preservation Program budget, which was $2,018,426.
I'll second.
Any
Before we
discussion?
vote, could I- Oh, no, just a quick question.
Sure.
Does the CPA, under the source column, does that mean that CPA is funding that preservation program? Or is the town funding it?
It comes from their,
It's the 3%,
Oh, it's their fees?
the 3%
Okay, we're
surcharge.
funding it, okay.
Yes.
Thank you for the clarification.
Any further discussion? Okay, David?
Okay, David, yes. Nick,
Yep?
Elaine?
Yes.
John,
yes.
Chris,
Yes.
Ed,
Yes.
Tony,
Yes.
Alice?
Yes.
Article 29, we need more information before we can vote on the purchases of 32 Locust Road conservation restrictions, so that'll be next week. Article 30, I move that we fund the Conservation Fund.
I second.
Any conversation, Ed?
The FC says that, is that the Finance Committee's going to fund it?
I don't think so, no.
What's FC?
What is FC?
Free cash.
Oh, free cash.
Free cash, okay. Got it.
We could do that.
All right. Are we
Okay, so David?
second done? Ready? Okay, David, yes. Nick?
Yes.
Elaine?
Yes.
John?
Yes.
Chris?
Yes.
Ed?
Yes.
Tony?
Yes.
Alice?
Yes.
All right.
I move Article 31, fund water quality testing and monitoring. This is for Cedar Pond, $215,000.
It's a variety of ponds. The Cedar is the big one in it.
Okay.
But it is,
So alum for Boland
that's
Pond?
it's a bunch of the different ponds. I can't remember which ones off and how much off the top of my head. But the big one is Cedar to try and get ahead of the alum, or putting alum in to try and get ahead of the bloom. And as the liaison to that committee, I think we should do it.
Any further conversation? Did we get a second, David?
Madam Chair, it's for Baker's and Lonnie's also. Those were the other ponds. And now in treatment for Baker's Pond.
For Baker's Pond and Boland Pond.
Is the oyster that we have to do the testing for.
Okay, thank you.
It's for the testing for Cedar Pond, plus also a study.
Great, thank you.
Thank you.
Did we get a second on that, David?
I'll second it if we didn't.
No further discussion, we can vote?
All right. David, yes. Nick?
Yes.
Elaine?
Yes.
John?
Yes.
Chris?
Yes.
Ed?
Yes.
Tony?
Yes.
Alice?
Yes.
All right.
I move that we vote on Article 32, the Mill Pond water quality improvements, $45,000.
I second it.
Any conversation? David, by roll call?
David, yes. Nick?
Yes.
Elaine?
Yes.
John?
Yes.
Chris?
Yes.
Ed?
Yes.
Tony?
Yes.
Alice?
Yes.
We're going to wait on voting on Article 33 and move to Article 34, which is to adopt the Orleans Comprehensive Plan.
Motion to adopt.
Any conversation?
I second it.
I'm sorry, what number?
Okay, Alice seconded. 34. Alice seconded. No conversation, we can vote, David?
David, yes. Nick?
Yes.
Elaine?
Yes.
John?
Yes.
Chris?
Yes.
Ed?
Yes.
Tony?
Yes.
Yes.
Alice? Yes.
Article 35, I move to establish, Article 35, establish special purpose stabilization fund for affordable housing and local infrastructure projects. There is no money associated with this at this time.
So all we're doing is establishing a fund.
Yes.
We're not funding it. That
Correct.
will be handled separately and with another
Correct.
vote.
Seconded?
You're
I'll
seconding? it?
second it.
Any further conversation? Okay, then David, let's
David-
vote.
David, yes. Nick?
Yes.
Elaine?
Yes.
John?
Yes.
Chris?
Yes.
Ed?
Yes.
Tony?
Yes.
Alice?
I'm going to abstain from that. I should have asked this question before, but it's fine. I'm abstaining. Did we get any clarification on what local infrastructure projects might mean?
I don't know.
Since most of our infrastructure is identified in under other funding pockets.
Yeah, I don't know,
I
Alice.
mean, so, you know. having
When
no-
we, at some point, if we fund it, we will determine why and what it's for. as I understand it. So
You're creating,
just creating it doesn't do anything except it's gonna be there.
we're creating the bucket, we're not filling it.
Right, but it establishes that the bucket is needed,
Yeah.
and I will abstain from that.
Okay?
So the two big items that we have left on the warrant are Articles 16 and 17. Land acquisition for the fire rescue station and the monies that will go for the funding of the construction. We can do several things, at being 8 o'clock. We can meet next week, April 2nd at 7 o'clock, to discuss these two things. By doing that, our votes will be printed in the warrant. That's why we're pushing for it. If the warrant goes to press on April 3rd, if we wait until our next meeting on April 9th, our votes will not be in print.
That's fine.
So I think I would entertain, like, would you like to, do we want to meet on April 2nd next week, or do you want to? I think we should meet on April 2nd so that we get our votes black and white.
I
think it's a very important vote that we, and I also think it's important that we have a conversation amongst ourselves about how we're moving forward on the fire rescue station.
Well, I was just going to ask before we adjourn, if we're going to postpone that vote, which I recommend we do, can we just quickly be sure we're clear on any outstanding research questions or data that we need in order to make that decision? Or are we all fine with what
I'm
we
not
know?
clear, what is the 13,000? Does that automatically mean we're all in for a lot more? I don't understand what we're.
I don't understand your
13
question.
is a different line, Tony.
That goes with
the bill-
18.
prior
We
year
voted
bills.
on that. We're looking at two blanks right there for now.
16 and 17.
Oh, the
16
blank, sorry, I'm looking at,
16
I
and
wasn't looking at
17.
17. No, I
Right.
understand.
We have three, 16, 17, and 29.
Yeah, I think,
Correct.
Citizens
Well,
petitions?
Next week,
We don't need that to be in print.
next Monday, the Fire Rescue Committee it's the 15th, sorry. It's the 15th, the Fire Rescue Committee is going to get numbers and details on the construction. They only talked generally about the overall, I don't remember the term of art, but it meant bulk of the building. And then the estimate for, the inside of the building was 20% of the bulk of the building, because that's what typically it is. But we didn't get any more figures on that, have not gotten any figures on that. And the 15th, they're coming to present to the committee exactly what they're gonna, what some of those costs are. So
That's about the building.
that's about the entire
Are
building,
there outstanding issues
inside and
on the
outside.
land acquisition?
That's all been in executive session so far, John.
Oh,
I
so
thought
we
the
can't-
land acquisition was, the dentist
You're saying we can't
acquisition
vote
was
on
I
passed.
think that's a second land.
I think that the Article 16 is for an executive session, i.e. we're not going to talk about it tonight.
We have to wait on that one.
We have no information about that.
Thank you.
as to whether it's moving forward.
We have a selectman
Correct.
who's raising that.
Just to let everybody know, the fire station committee is coming to the select board on Wednesday.
Do you want to get, Michael, please come, microphone, thank you.
The fire station committee is coming to the select board on Wednesday night. So
Wednesday
night
the 1st.
before. Yeah, the 1st, so that if you do want to attend that meeting or watch it, you'll be able to get an update from them, the latest update.
Thank you,
They-
Michael.
They're going to the select board, and they won't have good numbers. They were going to, according to them, I was just listening, they will come with much better numbers on the 15th. But the first is just a general discussion of where they are and what they've decided so far. That's what they said at the last firehouse meeting.
Michael, do you know whether or not you will be voting at your next select board meeting on Article 17?
I think it's gonna depend on what information and how the select board, if they feel comfortable. And if they don't vote then, yes, it won't get printed in the warrant. We may vote before town meeting, but, if people aren't comfortable, they won't vote. I don't know, you know, it's moving very fast, so the information they're getting, I wouldn't count on what they said on the 15th.
Well, it was moving very fast, and they were going to go to the first, but then the designer, the head at Ted, couldn't make that meeting, but he could make it the
I
15th.
appreciate all that, but it's changing daily, so hope maybe by Wednesday,
Oh,
yeah, we
I
won't. we
have
don't-
no,
I-
but that's where it was at the last meeting, and Ted couldn't attend, and he wanted to be there.
To the last
So you're
minute. We
saying
need
at
to wait
the
till
select board meeting on the
over. Know whether
15th
or
is
not
where
we
the
need to do
final information will be
They'll
presented?
have the best, at the last
No
meeting,
point meeting if
they
the
said,
select board isn't voting.
meeting on the 15th with the select board is going to have the best numbers.
The letter you're absolutely.
Now, as Michael has said, things are changing, and I haven't spoken to anybody since the last meeting.
Okay, so we have to meet next Thursday regardless, because we have to all work and approve on the Finance Committee letter that goes in the Indian.
I think we'll know a lot more. The select board will know a lot more on Wednesday, so if we meet Thursday, then we'll know.
But we have to meet next Thursday anyway, because we need to discuss the letter that the Finance Committee has in the annual town meeting warrant.
Okay.
So we will be meeting next Thursday, regardless of what the select board decides about these
So I would
16
wait
and 17.
For any vote till after, at least then.
So if there's a vote, if we have information with which we can vote, we will. But if we don't, we'll
won't.
follow in the select board's
Language meeting at
footsteps.
7?
Yeah.
Yes,
That's the first week of the,
yes, unless I find out
okay.
that we can meet at 5:30. But there's usually another, the CPC usually is there. But
So
they do
you're
not
going to
have a
let us
meeting.
know what time?
Yes, I will.
Thank you.
May I ask that, somebody kind of apprise us of whether enough information looks like it's prepared to present to the select board next week so that they might vote? Or is that asking for too much? Do you
I think we-
understand what I'm saying?
I do, but I think we have to watch the select board meeting or come to the select board meeting next week and hear that presentation.
I
I think
I
it's a
just put it
moving
on my.
target.
That's exactly right. I think we do if you're, we
Moving,
do ourselves a favor to be in the room listening to the presentation. Because I think if we're here, we had any questions, I'm pretty confident that Kevin would let us ask questions.
thank you.
By the way, the minutes of the last meeting have not been published.
And going back to our agenda, we have minutes that we got several weeks ago. Almost forgot about that. I would entertain a motion to approve the minutes that John Cooper did for February 12th.
I second that.
I'll third that.
We can go on, Chris is no longer online. So can we do that? We don't need to do roll call, right?
No.
He's not online, okay. All in favor of approving the minutes of February 12th?
Aye.
Aye.
Okay, and then I'd also entertain a motion to approve the minutes of March 4th, which were a set of minutes that Chris Kanaga did about our joint meeting with the Select Board.
I second that.
All in favor?
Aye.
I would also like to point out, since we're discussing minutes, that we are soon, very soon, to have a new recording secretary
Right.
Oh, good.
who will be doing the minutes of March 12th and tonight moving forward.
already
I
got
believe
that. I've
she's,
done the 12th.
have you done them?
Yeah, I just have to send them to you.
Oh, well, we'll let you do that.
It took 2 sentences.
Yes, no. Okay, that having been said, I'll see you all, if not before, April 2nd at 7 o'clock here, and I will let you know if we can have it at an earlier time.
April 6th.
Okay,
Thank you.
Otherwise, I will entertain a motion too.
adjourn.
Thank you.
Sorry, Elaine, did you say 7 on?
Don't forget to vote.
No.
I thought that.
Yes, we did. Vote to, we're all in favor of adjourning. Thank you. Right?
Yes.
Thank you.
99.